And action. Hey everyone, it's DrRic from Herbal 411. So today's topic I'm doing for Manny. He had a question about CBD. CBD stands for cannabidiol, and cannabidiol or CBD is one of the active ingredients in medical marijuana. It happens to also be the active ingredient in hemp. Now, hemp is over the counter. You'll find it in a variety of different vehicles: oil, pills, teas. I have a place called Entourage Clinical Services in Dundee, Illinois, that has a wide variety of different hemp-based products. That's their specialty. I also have a pharmaceutical compounding pharmacist in Hoffman Estates, Wholesome Health Pharmacy, that sells a few products in addition to doing the compounding and being a regular pharmacy. So there's places out there that you can get it, and I would always say go to places where you can actually touch, feel, see, and converse with the person that's selling it to you. Getting it on the internet or through a website, I would be careful unless you know where it's coming from. You want to know the quality. So, what about this CBD? Well, first off, if this is the first time you're finding me, please subscribe, hit the subscribe button below, and hit the alert button because I put out several different videos per week. It's all based on patient questions that I see in the office. I'm a family practitioner, integrative medicine doctor, and I see patients about 4 to 5 days a week, 50 hours a week. And there's usually a pervasive question of the day, and I like to answer it in video form because I'm sure other people have a question about the same thing. So with regards to CBD, I mentioned you can get it from hemp, and we'll talk about why somebody might need CBD. So my average American that comes in this Bartlett community, and I have people that come in from Chicago and a couple other places too. Usually I'll find people have inflammation. In fact, a lot of the buzzword about 5 years ago is inflammation. Inflammation was the cause of everything: cancer, diabetes, autoimmune disease, and I think it's still rooted in a lot of those diseases. So it behooves an average American to control inflammation. Now, if you don't have any of those diseases, that you might still have an ache or pain, you might still have a really tough workout, and you'll be sore the next day. That's inflammation too. And whether you have chronic disease, whether you have just an acute flare-up of problems, I think it's wise to have an anti-inflammatory lifestyle. And part of that is using food, exercise, stretching, mindfulness. But if you happen to be afflicted with a disease process or a really severe area of spasm and pain, CBD. And especially with the new pushing down of the anti-inflammatories, Motrin, ibuprofen, Aleve, Advil, naproxen, they've all been kind of pushed down because of their association with heart disease. So you have to be careful about chronic use of those medicines. Thus far, CBD has not been correlated with any kind of side effect or ill effect. Some would say it comes from a plant, so it's natural. Well, yes. So this is how we're going to use it. Or this is how I suggest my patients use it. So if you have a problem, what I would suggest is you keep everything else stable in your life. Because during the time that we try to see if CBD will help, or for that matter, an anti-inflammatory or pain reliever will help, you always want everything else, all variables, stable. So I usually tell my patients to pick a 3 to 4 week block of time. No variability, no changes in your workout. If you do work out, no changes in your work, no flights, no long drives, no moves, no lifting in the house. You do that all stable, and then you add on CBD. My suggestion would be, especially for the chronic pain patients or the autoimmune patients, the Crohn's disease patients, try to get CBD in you or on you 3 times a day. I think if you do it 3 times a day, if it's oral, which it does come in oral form, comes in droppers, comes in pills. If it's edibles, if you take it in oral form and you're on a regular basis doing it, you'll have a constant level in the bloodstream. When you have a constant level in the bloodstream, then the blood will act as a highway to get that anti-inflammatory CBD to every cell in your body to hopefully bring down inflammation. So again, same concept as Advil. If you're trying to use Advil or Tylenol, if you're trying to use Tylenol for fever, you don't wait for the fever to pop up, especially in a little kid. You don't want a fever to cause a seizure. You want to bring that fever down till the infection is wiped out. So you do Tylenol on a regular basis. Or for fear that if you stop the Tylenol, wait for the fever, and then you chase the fever with the Tylenol, you'll bring it down, but you probably already had the seizure. So same thing with the inflammation. You want to be doing CBD on a regular basis. I'd say 3 times a day is pretty adequate. Now, some people will really be sensitive or weary about starting anything. I think you can use topical CBD. It does come in oils. Topical oils can get through, especially if you have like joint pain, rheumatoid arthritis, where there's not too much body fat, and you can get the topical to penetrate through. Again, that depends on the carrier that the CBD oil is in. Sometimes there are certain carriers that'll get it through the skin and into the area of inflammation, around the muscle joint area faster. If you have low back pain, I've actually seen some CBD patches come from hemp. Sometimes though, if you want a faster and bigger response, you would get it in the bloodstream. Get it into the mouth, get it into the digestive system, absorb it, and then get it into the bloodstream. I think that's the most assured way to get a good level. If you want to avoid that, or if you can't do that, then I think topical is reasonable. But I do believe that topical has less potency and less predictive levels than oral. So, and that's all this is predictive value. So if you have a fly-by-night company that you don't know of, you're just getting it because it's cheap on Amazon, you know the quality could vary between bottles or oils or droppers, and you won't be able to measure how much to use. If you go to a good place, if you know the person that's selling it to you, if you can ask them where they get it from, how they test for quality assurance, I think you'll have a higher chance of success. Success of bringing down inflammation, bringing down suffering. So that's what I would do for that 3 to 4 week block. And then if there's no effect, meaning that you do a little bit of a snapshot of, you account for how life is before you start, and you account for how life is after that 4-week trial. If you don't notice anything, there's 2 possibilities. Number one, either you're underdosing, you need more to take, and that you'd have to work out with the person at the place that you bought it from, or perhaps a more frequent interval of time. Sometimes it could be a bad quality. It could also be that you have way too much inflammation, you have to add something else to that, which will be what we talk about now. So when I flashed my subscribe suggestion, I also have these 2 things, THC and CBD. Thus far I've talked about hemp for inflammation control, autoimmune control, and in some cases you can use hemp, CBD, to calm the brain too. I've had a couple patients use hemp-based vaping, and they've said that they feel calm when they use the vape. Now, the studies are really limited, but I'm not going to negate anybody's anecdotal success, but I would always go with the oral and the topical. If in case the vape is all you have, okay, just watch your lungs, but the oil in the vape fluid, we're not sure of the long-term effects of that. And it's going to the lungs, it could hurt, but if that's all we have and you're really suffering, I think it's worth it. Again, 3 times a day. So the vape is actually fastest onset because you go straight to the bloodstream from the lung tissue. But it's a little bit irritating if you're not used to vaping. But you'll still get a decent amount of CBD on a regular basis for your trial. Now, as we move into medical marijuana also has CBD in it, but it is known for its THC properties. These are the 2 active ingredients. So tetrahydrocannabinol and cannabidiol both exist in the marijuana plant. And marijuana plants, now that we have dispensaries and most of the states have medical use, there is a wide variety of different vehicles that these guys are available in. Now, obviously, if you go to your local dispensary, you'll see that I happen to have the menus that I printed up online for Pharmacist, really good local company, local dispensary group. Also, Triple C in Naperville, nice dispensary group. I have a couple patients that live down that way. And Healthways. So Healthways seems to have the easiest readout. And if you look at this, there's the name of the product and then the breakdown of the percentage. It actually can give you the milligram dose too. So here's where the trick is. And I think it's just like making a recipe of food. when you have a disease process, no matter what the disease process is, I mentioned cancer, I mentioned autoimmune disease like thyroid, Hashimoto's thyroiditis, I mentioned Crohn's disease, sometimes fibromyalgia. When you have inflammation, you want to be able to knock down that inflammation properly. Now, you still have to do all those basic things of healthy anti-inflammatory lifestyle I mentioned before, but this might be another way in. Instead of taking so many narcotics, muscle relaxants, long-term steroids, disease-modifying agents, rheumatology, they're all good, but the stronger the medicine, the higher the side effect profile. So if we can get into something like medical marijuana and herbal or hemp-based CBD, I think that'd be great. I already told you about how to use the CBD, but as far as inflammation control, one option is, if you don't have any great luck with the hemp-based CBD, even maximizing on it or using several different vehicles, topical, oral, vaped, then you might want to try marijuana-based CBD. The only problem, as you might find with some of the dispensaries, is that usually the products of medical marijuana that are dominant CBD, which is what I want for my patients, more dominant CBD for inflammation, less of the THC because I don't want you high all day. But the vehicles, the things that are sold with high CBD are usually not that popular, so the dispensaries are businesses too, and they might not sell as many varieties of high CBD dominant product. So that's what the challenge is, but you'll have to kind of research. I think the menus usually change once a month a little bit, but again, if we're trying to break down the inflammation that you're suffering from, whether it's a disease process or it's just an ache because you worked out really hard, my suggestion is you don't do anything else different for that month, the 3 to 4 weeks, and you try something of one of the products at your local dispensary if you get approved and certified. It's mostly CBD. You want to do, especially if you're going to be using this 2 to 3 times a day, you do not want much of the THC because you can be impaired, you can have bad decision making. It probably won't get to that, but I don't want my patients to take a chance. I want CBD mostly. So we go on a 3 time a day basis, topical, oral, edible, maybe liquid, tincture, or vape, or smoke. Now, if you get into smoking the leaf, you probably won't be able to get the percentage breakdown of the CBD to THC, but everything else that I just mentioned, usually they'll have a very tiny ingredient sticker on the box that you get or the bottle that you get, and it'll have the breakdown, like I mentioned on the Healthways, pharmacist Healthways. I think it's imperative that any dispensary that's selling product, as long as it's not leaf, has to have a breakdown of percentage, whether it's percentage, ratio, or milligram dose. So go for the highest CBD, go for the lowest THC on a regular basis to knock down inflammation and see if that might be part of your recipe. If you maximize on something like that, you don't get high or stoned all day long, you can still function, but you've maximized on your CBD 2 to 3 times a day, and you're still not noticing any dent in your symptoms after 3 weeks, you might want to go a little higher, or here's the cool thing, you might want to add the hemp-based product. Now, it's only a theory of mine, but I think if you add hemp-based product, which is CBD, from that species, the hemp, and you have medical marijuana, which theoretically has CBD receptor stimulators in it, and THC receptor stimulators in it, you should get a little bit of a synergistic stimulation of the anti-inflammatory properties. So CBD receptors usually found in white blood cells. Thus the reason if you calm down the white blood cells, you'll calm down that autoimmune response or the inflammation response. Versus the THC, which is usually found in brain tissue or nerve tissue. So the more THC is in your product that you're trying to experiment with, the more of a body and brain high you'll get while we try to figure out bringing down inflammation and touching inflammation as much as possible. So you might get 2 different messages. I would want to try to get through life this way first. Now, here's the caveat. If you have those diseases that I mentioned, those autoimmune diseases, those inflammatory diseases, and you have insomnia, anxiety, post-traumatic stress disorder, then you now have a mood component to it. And if the mood is keeping you at home and keeping you immobile, then that becomes the dominant issue, and that's where the THC might be your experiment 3 times a day. I mean, some of you are shaking your heads saying, well, that could make people a little bit off. Well, I have news for you. There are people taking Xanax 3 times a day, and that's mood altering, and it can get to the point of also making bad decisions or giving patients bad decision making and decreasing reaction time too. So between Xanax and Zoloft and the SSRIs, SNRIs, other MAO inhibitors, all the psychiatric medicines being used or thrown at patients all day long, you will already have almost a look-alike side effect. So I'd rather have somebody try the lowest dose of THC in addition to CBD. So, not to get off track, but we're talking about inflammation first. CBD was the first thing I talked about from hemp. CBD dominant product from medical marijuana. And if you can get that 3 to 4 week window of an experiment to get your recipe, you find the product that works great for you, and you can bring down your inflammation, make yourself more useful, have less trigger points, have less suffering, have better sleep, then you've found it. That's your recipe. And you're going to have to play around with the different vehicles. So as best as possible, especially if you have THC mixed in, I would probably start with a topical. There's not that many topicals out there, as you'll check in their menus that they have online. But start with a topical 3 times a day, just to the areas. For mine, I'm a fibromyalgia sufferer. I have these trigger points up here that usually shoot into the head. If I don't catch it in time, and give me headache, nausea, vomiting, and I'm out. But luckily I have my fibro under control. I don't use medical marijuana. I have just been able to control it with other means as far as nutrition, mindful practice, exercise, flexibility, yoga. But if we're using this medical marijuana, try topical first, mostly CBD dominant. If it doesn't work, go a little higher, or if you can't find anything else, do the topical, maybe a little bit of oral. The other sidebar is you can maybe add a little bit of medical marijuana CBD dominant plus a little bit of CBD from hemp mixed together. You'd have to mix it yourself or put it on and apply it yourself, or take the pill. There's no interaction, no problems with taking medical marijuana edible, tincture, or topical, and then doing the other thing from hemp 3 times a day as well. I think if you match them up, there's no side effects, no interactions. I think the CBD from hemp and the CBD from your medical marijuana might actually improve the way both work together, synergistically improvement. And if you happen to have, if you get through a great 3 to 4 weeks, you know your recipe, then you might want to figure out your rescue. Most of my chronic pain or autoimmune disease patients or post-traumatic stress disease patients will have a difficulty with sleeping at night, whether it's because of the mood or whether it's because of ache and pain. Sometimes that's when you go for your rescue. So on top of all that CBD experiment, as far as every single day, 3 times a day on a regular basis, you always have to have a rescue. And that's where we go with a dominant form of THC. The least amount of CBD, but the most amount of THC, and that's where you want it at a fast access. So smoke, again, between smoking and vaping, smoking, you can theoretically burn leaf and have more tar. It won't be as much tar as cigarette smoking, but cigarette smoking, you take in the burnt leaf and you blow it out fast. In marijuana smoking, you take in the burnt leaf and you hold it, like most marijuana users do. They hold it for a long amount of time. So the question is, the tar exposure is a little bit longer. So it could theoretically lead to problems down the line, but be careful. If you can do vaping with the oil-based product of mostly THC, better. I hear that the vape isn't as strong as the leaf, and it's more expensive than the leaf. So you'll have to kind of wrestle with that. But the bottom line is, at night, fast access to bring down sleep, or bring on sleep, control pain, get a good night's sleep, less tossing and turning, better morning. Better morning means more wakeful morning. More wakeful morning means more productive. More productive means better outlook. And then you're setting yourself up for success. If you happen to have a very, very bad outbreak in the daytime, then you might want to go for your rescue, whatever it may be. Smoke, vape, edible, tincture, topical. But again, as we get towards the rescues, you want to go fast. As we get towards the chronics, you want to go slow. If you happen to need a rescue during the day, I would plant myself, not drive, have somebody else drive, not make any bad decisions, no heavy machinery operating, and then see how you do. But that's my basic formula for taking care of inflammation using hemp and medical marijuana. So hopefully this helps. And remember, not everybody qualifies for medical marijuana. In the IHSS, or at least the Illinois Human Services, we have the 40 qualifying conditions that'll get you to certify for a medical marijuana card. This is all online. The Illinois Department of Public Health, is the website, and you'll see the 40 qualifying conditions. If you can back that up, you can't just walk into a doctor's office and say, I have this. You have to have proof. At least I like to see proof, whether it's from a psychologist, psychiatrist for post-traumatic stress disorder, or if it's from a rheumatologist with blood tests. I can certainly order the blood test myself, but if you can bring that in when you come in to see me or any other qualifying physician, it would speed up the whole process. Also, finally, if you're going through the medical marijuana, you really should know what you're getting after you get your card before you go shopping. In Illinois, the dispensaries, from what I hear, they can't show product. So you just go into a locked door, you meet somebody on the other side, you tell them, what do you want for the menu? They might have a nice menu, I don't know. And then they go out in the back and they come out, you pay for it, you're gone. In Colorado, I visited a dispensary in Colorado. You can actually see and smell the product and kind of gauge it. So it's kind of nice. It's always nice to look at the product, read how much THC there is. You can get that, but it's just something tactile about feeling the product before you buy it. So just know that you have to qualify first. It takes a couple weeks to a couple months to get the card, but not for a CBD, which is from hemp. Not hemp, which has CBD. So you can always just load up while waiting for the card, load up with your hemp, get your basic dosing curve going, and maybe the medical marijuana, when it comes in, you can add it to everything, substitute it, or you're on your way to a better lifestyle with less suffering. If you have any questions, you can always ask the dispensary guys. But again, if you go into a car dealership with a blank check saying you want to drive anything and everything, or buy anything and everything, you'll probably be tucked into buying the most expensive vehicle. So you should know what you're doing before you go shopping, and it'll make it a better experience. Will bring down suffering. You'll make it a better lifestyle. You'll be able to move past your inflammation, maybe get less medicines, move back to moving properly, activities like a normal human being, sleep like a normal human being, and mood like a normal human being. Don't forget, if this was helpful, share it with other people, but subscribe and I can get you more videos. Just leave a request on the comments below and I'll see if I can get them for you.